Hey, Adni fam, it's Anthony. I am so excited to be joined by Scott Shelander, who is the president and CEO of ALOIS Healthcare. Did I get that right?
Great job. You did. Great job.
ALOIS Healthcare. Yes, I love it. And I was actually just on the website and saw that ALOIS means warrior, which I think is so
Yes.
awesome. And I definitely want to dive into that. But Scott
Okay.
has literally an incredible background in healthcare staffing, truly an expert we get to hear from today. So thank you so much, Scott, for being on the Adni Huddle podcast.
Oh, it's my pleasure. Again, compliment and hats off to all the hard work that you're doing to support our care providers and clinicians on the front line. It's quite admirable. It's a great job.
Thank you so much. That means a lot. Well, would love to dive into your story. Maybe if you could just
Mhm.
start by telling our listeners like who you are, what your
Sure.
background is, and how you ended up where you are today.
Absolutely. It's kind of a unique story. I think everybody has their own story, and that's what makes our stories, I think, powerful. But for me, I grew up in a very small town, very humbled roots. Mom and dad who really raised me the right way, hard work and discipline. Up every morning making your bed type of environment. So I appreciate that upbringing. Had a lot of very important, influential people in my life throughout the path, coaches, mentors, and so on. And then, of course, I give a lot of credit to my wife, who I met in college, and then we've been married for it'll be 28 years this August. So again, she's been my partner and my rock in this whole thing. So I actually started in financial services, and really I break my journey up into different segments that taught me a lot about being who I am today and how I operate. So in my early part of my career, I was in financial services, so I got a lot of, I would say, again, went to college. That's where I met my wife. Graduated. Didn't really know. I just knew I wanted to be in a world of creating and building and just exciting energy was kind of like my platform. I really didn't know how or what, and then got the first opportunity in financial services. So that's where I really learned a lot about um, you know uh, problem solving, finances, P&L reading, management, GL detail reports, down to almost like an accounting minor, if you will, because my role quickly developed where I was leading self-producing, and then a leader of producers, and then a leader of leaders. And at the very ripe age of 27, leading 9 offices in 5 different states. And so I was always on the road. And so I really got a crash course on how to lead people in a remote setting, how to be really good about going in and diving into the right critical areas of an operation and finding opportunities for savings and opportunities for growth. Uh, Again, along the way, learning from different mentors how to motivate remote work environments at that time, because I was decentralized and I had a lot of different remote offices across those 5 states. So that was the first part of my career. And so again, I look at that as a very growth oriented stage, a great start for me to get out of my first 10 years. And then I moved into technology, not by choice, but the 2008 financial crisis kind of caused me to move into a different area of opportunity, which was tech. And that's really I got the part of my career and part of my experience with understanding tech stacks, understanding integrations, APIs, really understanding how technology could really be incorporated and help an organization get more efficient, get more streamlined, and really allow your employees to do more with less. And so that was kind of the area of tech deployment and really giving me that background within, again, my tech space. Then I moved, again, opportunity presented itself. I found myself representing an organization and a division that had a manufacturing background. So I was leading a division where we were a manufacturer. And so that's really, I got my operations excellence pillar, where I learned a lot about Six Sigma. I learned a lot about how to run Kaizen events, how to get operational efficiencies, cut waste, remove friction processes. So all of those things at different points in my career provided me great value to what led me to healthcare staffing and healthcare workforce solutions, right? So I again, another opportunity presented itself through a mutual friend, and I found myself as a chief operating officer of a healthcare staffing firm. And so what I came in to healthcare really with not a lot of knowledge about the healthcare end of it, in the sense of growing through friendships and mentors and people that I've brought on to be experts, but really from an operational efficiency standpoint. How do we remove all of the components that make the clinicians angry or frustrated with working with an agency, to the clients, to the accounting and billing processes, the whole scope, or what we would call the flywheel. How do we make it better? How do we make it more streamlined? How do we incorporate technology? How do we motivate and encourage not only our clinicians in the field, but our internal employees working hard? How do we train them? How do we bring all of those components together so that we have this well-oiled, um, uh, functioning juggernaut in healthcare staffing? So that's my journey, kind of in a 5-minute nutshell. And that's how I got into healthcare staffing.
That's amazing. And I'm sure the like operational background, finance background has been so helpful in healthcare staffing, because it is a lot operationally. There's a lot of technology. There's a lot of kind of unique things on the financing side, especially with just how everyone is paid and making money. So that's such a kind of well-rounded background to have in that. And I'm curious to learn a little bit more about ALOIS Healthcare and kind of, what kind of sets your agency apart. If you could just kind of share more about the types of staffing you guys provide, and maybe even share us kind of where that warrior ideal or value comes from.
Absolutely. I'm here at ALOIS predominantly because our owners and our founders, Kinjal Desai and Farhad Wanda, are wonderful individuals that are good people, full of integrity. We had a really healthy, good conversation about the current market. How do we compete? How do we build a certain model? And so I'll take you all the way back to the founding of 2016 of ALOIS and why it's ALOIS and what does it mean. So when they founded ALOIS, it was the two of them and a handful of people that have decided to follow them from a predecessor, basically a previous employment, where again they were having some difficulty with the principal and being full of integrity and all the things that we talked about. So they started ALOIS, and ALOIS means warrior, right? And that's the type of mentality it takes to start anything, right? When you think of the mentality of a warrior, it's I'm going to go in and I'm going to win, because if you think of losing, you've already lost. So they have founded ALOIS in 2016 in a very one single office, and with and started with scratch, no clients, no customers, and they got up off the ground and built it from scratch. So had a lot of respect for them in doing that. And what we provide, we're now a global solutions-based company that's headquartered in India, and we have presence in India. We have presence all over India. We have presence in the UK and Europe. We have the presence in Poland. We have presence in Australia. We have presence in APAC, as we talked about, in the Middle East. We also have presence in South and North America. So true global company. So we have a scale, right? We have a very large scale of how we can tap into resources all across the globe. How we can utilize those resources and deploy those resources are very powerful. So from the healthcare side of the business, that makes us very competitive. So not only very competitive for our clients, but very competitive for our clinicians, because we can bring the both of those worlds together, operate on some very competitive margins. And then how do we bring technology into my background specifically? How do we bring technology in to make sure that we're connecting and we're building this with a friction-free or an experience-led type of environment where the clinician feels that their best interest is being taken care of, their questions are getting answers, how they can interact with this can happen with their phone. How can they do all this but also still have US based representation? So if they need that, they feel like they have that, we can present that to them as well. So again, we have a very, very competitive model that really gives us the edge, I would say, to compete in today's market with reducing bill rates, reducing client orders. All of those things are real. And what excites me about what ALOIS can do from an organization is we have the scale and the global presence to, again, attack any challenge. We also have that local focus to where the clinician knows that it's not just about the number, it's about them. And that's our goal, is to make it about them and make the experience something where they feel they can get the best pay package in the industry, but also the support that comes in behind them and supports them in their efforts that they do every single day is second to none.
I love that. Thanks for sharing that, Scott. And I'm curious, like a little bit more about what is like a day in the life for you. I feel like for someone who maybe doesn't know kind of the behind the scenes of the healthcare staffing world, like as president CEO, what is like a week in a life of Scott look like?
Oh, well, great question. I've never had that before, but I would say that I'm a very highly disciplined individual that, again, my upbringing, my coaches, all the different things in my life, there's not a day I'm not at the gym at 5 a.m. I really believe strongly in taking care of your physical body to make sure that you can achieve everything possible. So again, get off to the right start. And then I highly encourage my team to read. I believe that leaders are readers. So I spend a good portion either listening to Audible, or reading and writing, making sure that I have my quiet time in the morning and that I get myself centered and focused. And then it's really just diving in. We are very, we follow a book called Scaling Up. It's really a book on how to scale a business and how to have structure and operating systems. So we're very structured on when we meet, how we meet, having an agenda, executing a level 10 meeting. All those things are very structured throughout the week. So my meetings are traditionally the same time with structure on our executive meetings, our one-on-ones, our daily huddles, our weekly check-ins. So again, a lot of touch points with my leaders, a lot of industry touch points. So I stay in touch with a lot of my peers to make sure that we're communicating, that, there's always trying to fill in the blind spots with people that I put a lot of trust and faith in, as well as I think that they do the same with me. And so we're always communicating, making sure we see it all through the same lens. And then again, a lot of industry research, a lot of making sure that we're doing our best to support the clinicians. I sit through a lot of tech demos to make sure I'm aware of everything that's available to us, to make sure that we're putting the right thing on our strategic mapping. And so we go through we have annual strategic initiatives, and we go through 4 quarterly resets to make sure that we're pushing forth the big issues that move the business forward. So we do a lot of those components. And then just engaging. I make sure that I try to engage with our employees, engage with industry experts, attend seminars, whether they be virtually or in person, and then carving out time for the most important people in my life, my family.
I love it. Thank you for sharing the behind the scenes. It's very interesting. I feel like, especially, you don't always get to hear of like what the kind of week looks like for a CEO of a healthcare staffing agency. And with you being kind of such an expert, and I feel like having now seen the market kind of through this past few years and the evolution it's been, curious if you could just share like some transparency for, new travelers that are listening to the podcast, or current travelers that, maybe they saw their friends in COVID get some incredible rates for their contract. And now as they kind of enter the healthcare staffing world, they're definitely not seeing those insanely high rates anymore. And I think I've been hearing from our community just some confusion, or just wanting to understand why that is. So could you just kind of share like some expertise and insights on why the contracts are coming down, and kind of where you see them in the next like 1 to 2 years?
Yeah, sure. Well, I think, supply and demand too, right? So the reason why rates escalated so quickly and so fast was the demand was there from a COVID standpoint, right? There was a huge demand. The only thing that they had to try to attract talent and get the census counts met, and really try to bring in the travelers, which they needed desperately, was to keep escalating the rates. In which turn, those rates were, in most cases, I know in our cases, in the reporting data, was directly given to the nurses, right? So they saw that substantial increase in pay. And so it drew in a lot of first-time travelers. It drew in a lot of travelers. The other thing that's happened over the last year was COVID impacted and really drew focus and attention to the compact state licensing, right? So it really drew a lot of attention to how does somebody go through the rigorous process of getting a license in PA, but not allowed to practice nursing in Ohio, right? And so there was a lot of focus where there was a lot of new states that entered the compact licensure, which was huge for traveling, right? It opened up doors for individuals that couldn't travel in the past or didn't have that, that capability of going into a neighboring state because they weren't in the compact licensure. So that's opened a lot of doors. So a lot of those things were really good for the travel industry. Now what you have is, hospital systems are compressed, right? They operate on a margin-based platform or on a net income-based platform, and so when their largest expense is contingent workforce spend, it becomes, even though it's a need, it becomes a target when they start to look at how do they get back to an operating model that's sustainable. So that's really what's happened and what's caused the reduction in bill rates and pay rates is really a sustainable model for these hospital systems to stay in business, right? Because at the end of the day, if you're losing money, it's hard to stay in business. And all those COVID funding, all of those monies have gone away. So now we're back to brass tacks, back to regular operating models, which again couldn't support or couldn't continue to operate on those COVID-based models. So the good news is that bill rates have settled in at a premium over what bill rates were prior to COVID, right? So you've had this anomaly, COVID, and now you're back to a more standardized rates, which are even above where they were prior COVID. So I think we've pretty much leveled off, and we'll continue to see some peaks and valleys depending upon need and demand on certain specialties, certain professions, if you will, and specialties, and then also certain geographic locations. But I would say that if you're in the business of travel, nursing, travel allied, you do it for the flexibility. You do it because it's a 13 or an 8-week contract, and you don't want to be tied down to a permanent location. You want to go experience a winter in Arizona or Florida or Texas or the Carolinas. You want to maybe return home for one contract in again, wherever home is, but you do it more for the flexibility and the ability to experience what traveling has to offer. And that's even if you're doing it locally, you do it because it's a contract based, and you can always renegotiate that contract every 13 weeks or 8 weeks. So when you sign on to a perm job, and again, perm jobs are great too, they're just for a different period and a different person, right? But when you sign into that perm job, typically they're locking you into a year, 2-year, 3-year contract. And so you're locked in. And so you don't feel like you have a lot of flexibility. So the people that typically travel for us, or what we get the feedback is I enjoy the flexibility, even if it's a 50 or 100 miles from where I live. I enjoy the flexibility of renegotiating and kind of moving every 13 weeks to get a different experience. So that's really what contingent workforce is, and what travel nursing and travel allied is it provides you with that flexibility. So when you're seeking a firm, you want to seek a firm that has access to those jobs and provides, again, technology that allows you to kind of access those opportunities on your timing, right? Let's face it, you guys are working maybe 12-hour shifts, 3 days, 4 days a week. You don't have your traditional work schedule where you're home at 5 and you can take a phone call. So you need to be able to do things on your time at your flexibility, which might be at midnight, right? It might be at 1 a.m. when you finish a shift. It could be at 6 a.m, or it could be at 7 a.m. It could be at any of those times and so that's where we're really pushing for, is to give that human element, but to give that technology to put the power in the hand of the clinician to say, I've been with ALOIS. Again, they have a great reward-based system that encourages me and incentivizes me and appreciates me. But I also have, at my mobile app, I have the ability to kind of select my next assignment or apply for 2 or 3 different jobs in anywhere I want to go based upon my preferences. So I can deliver them to them based upon their preferences, or they can go seek them out on their own time. So again, that's what I would say is happening in the industry. You're seeing a shift from probably a pre-COVID environment where it was a lot of choppy, it was a lot of state by state, to where after COVID we got a settlement in bill rates and pay rates. but now it's more, I would say, tech enabled and really putting that power back into the clinician's hand to say, hey, this is where I want to go, this is how I want to get there, and really using the piece of tech to really be the spearhead and the catalyst to get that done.
I love the thoughts, especially surrounding technology. I think that is definitely something even post-pandemic you've really seen come into the space a lot more, especially surrounding things like AI and automation. I'm curious, kind of as you mentioned, the technology being used to kind of bring the human element into healthcare staffing and helping healthcare clinicians be able to manage their professional life, be able to have that flexibility, as you mentioned. How do you feel that like the continued implementation of technology in the space will kind of keep or take away like the human factor of healthcare staffing? Because I think one thing I hear a lot from travelers is like how much they actually value the relationship, for example, they build with their recruiter. And a lot of the, actual business model of healthcare staffing is very relationship based and is, centered a lot around those relationships. So I'm curious how you can see technology either like benefiting or potentially harming some of the like human first types of relationships that are built, especially when, clinicians are kind of texted all the time or called all the time through like all these now automated like AI bots.
Yeah. Yeah, no, I think AI and technology has its place, and I think it's very powerful. You're never going to, in my opinion, you're never going to replace the human element of the connectivity that's required. And it just when you're the human to human approach is got to be front and center. And so we can help that clinician on multiple fronts, right? The recruiter, obviously, we employee relations components to it that helps the clinician with questions or concerns. So we're never gonna remove those human elements. But I also think, again, if it's a certain time, just like all of us, we love human relationships, but we also love Amazon, right? We also love the ability on our time in our space to make some demands. Now, if we have a question or have a concern, we want to pick up the phone or we want to do an instant chat. We want to have that person on the other end of the line help us. And so that's what we look to advance the human opportunity with the technology versus the opposite, right? We don't want to replace the human element of any of our cyclical attributes. What we want to do is make sure that we're giving everybody tech-enabled components to speed the process, to remove friction points. And so when you can do that in your process, in your process cycle, you get the best of both worlds, right? So again, I don't think that the strategic plan is to never take away the recruiter, never take away the personal relationship with the clinician. They're always going to have that, but it's how do you engage with that recruiter, right? Do you want to pick up the phone and have a conversation, or do you want to do a chat through the app? Do you just want to do a quick chat? Hey, I saw this job. What can you tell me about? It's in New Hampshire. It's a 13-week contract. What can you tell me about it? And having the ability, I'm going to be on break in 35 minutes. Call me in 35 minutes, right? So those are the enablements I think that are very, very important, where we can get really lasered focused and really provide the clinician the accessibility to the recruiter or to the team helping them and supporting them versus just waiting to make the phone call. And so those are the elements where I think listen, technology is here to stay. The barrage of tech stacks and tech enablement in our space is not going to go away. We are in a space where supply and demand is continuing to be an issue. The demand is going to continue to outpace the supply of nurses and clinicians. So we have to get a way to stay competitive, to be experience led, to be experience driven with the clinician, because they're going to have options. And so it's got to be cutting edge. It's got to be relational, but it also has to be frictionless. It has to be easy. It has to be enjoyable experience, or else, again, there's going to be another firm out there offering them a better experience.
I love that. No, 100% agree with that. It's like, I love how you say the word enable and, helping to create that human connection and that relationship with technology and making that more efficient and productive for everyone. I think that is really well said. So if there are any clinicians out there that are listening that want to connect with ALOIS, could you just share like how they can get in touch with you and where they can learn more?
Yeah, absolutely. Well, the best way is our website, right, which is ALOISHealthcare.com. So there's opportunities to connect with all of our available openings. You can apply. You can look for the profession, the specialty, the state, very granular that you can kind of dive in there. I'm on LinkedIn, so you can reach out and connect with me. I'm connected with a ton of clinicians. Again, I love to see their feedback. I love to see their posts. I love to connect and make sure that I have a finger on the pulse from all sides of the business. And again, LinkedIn or my email, which is scott.shelander@aloishealthcare.com, is a great way to connect with me as well. But the best way to connect with us just in general would be the website and the job board. Again, you don't have to apply. You don't have to do any major gross data entry. There's a quick apply process in which you can be in touch with one of our recruiters within seconds. So, and then
That's great.
We are deploying the ALOIS Healthcare app at the end of this month. So you'll be able to download
Congrats.
on Apple and on Google Play. It'll be ALOIS Healthcare mobile app.
That's amazing. No, and I love the advice you gave too of like you can go to the website and you can just like talk to a recruiter and learn more. It doesn't necessarily mean that like you have to accept a job or like you have to like apply. Like I think it's sometimes scary for like first-time travelers or clinicians to like apply necessarily because they're like, oh, I don't know what I'm signing up for, but just have that conversation and get to learn more about Alois and the warrior, which I love.
Yeah.
So, Scott, we always end our podcast episodes with the last question, which is kind of related to Adni's mission of just bringing the human element back into healthcare staffing, and really just creating unity in healthcare. I think that's something as like healthcare workers ourselves, we always just wanted more of. So, curious if you could share your opinion for why you believe this kind of human factor in healthcare staffing is important maybe now than ever before, and why unity will continue to be like something we should all strive for.
Yeah, well, I think it's a great point. I think that the the mission of human beings and helping one another is at the core of what we do, right? I mean, it's just at the core of who we are. People are in this industry because they're called to serve, right? And they're called to help the most needed, and at our most vulnerable points in our life is when the clinicians step in to apply a drug or help an ailing parent or an ailing grandparent, or deliver our children, or trauma nurses and physicians, and all the individuals helping to save a life or give it their best effort. All those things are more than admirable. And unity is so important when you get to that element, because nothing else matters, right? If you're here to serve and protect and help the individual at their most vulnerable point of the life, all this other stuff goes away, and it's about the core mission. And so I think that's what we're on, is a core mission to help people. And I think that's why it's ever more important to make sure that we're locked hand in hand, elbow in elbow, and we're unified together, fighting for the cause of helping people. And that's why I do what I do. Is I'm really mission led and driven. I believe that we are here to serve and not be served. I mean, that's the core of what I believe. I think everything I do, from the minute I wake up to the minute I go to bed, it's how can we get better? How can we do the role better? How can we support better? How can we provide more? All of those things matter. So it's a never resting, never stopping moment where we're constantly focused on sharpening the sword. And in the warrior spirit. So one of the things that we are doing is we're launching our care provider awards, right? Because we want to recognize what we call our warriors and scrubs, right? The people that are out there on the front line doing the heavy lifting, doing the hard work. So every quarter we're going to be nominated and awarding our warrior award to our care providers who are out there on the front lines, and providing them with obviously some fun and enjoyable tangible items, but more than anything, just the recognition of what their work is doing and the people that they're helping. So we have a lot of things coming in 2024, which I'm excited about, to really support that unity vision, that core value of supporting one another and helping one another. And I think those are the most important elements. You're never going to lose that human connection through this entire process. You can bring technology in, you can You can offer great pay packages and unlimited jobs, but at the end of the day, people want to connect to something. They want to be part of something bigger. And that's what we're creating at ALOIS, is the ability to connect, the ability to create a longer vision, a longer takeoff and landing pad, to make sure that everybody's taken care of and everybody has exactly what they're looking for from an agency. And I'm really excited for that. But at the end of the day, I love the mission that you guys are on. Again, there's very similarities in core values, and that's why we're looking to partner up and really jump on that bandwagon of supporting the clinicians, supporting the warriors that are out there in scrubs doing the hard work.
I love it. So if you are a healthcare worker out there and you want to be a warrior, aloishealthcare.com, you go become the warrior. That is like the best. I love the warrior. I think that is, I know during the pandemic, other places it was like hero was the word, but I think that warrior personally resonates a lot more with me because it's just really cooler and better.
Yeah, you got to have a warrior mindset, right? When you
Yeah.
go in and you're taking a lot of the brunt that our frontline workers take, they are heroes. I don't want to neglect that they're not heroes, because they are, but they have to have a warrior mindset. Just to continue to fight through it and to build through it. So we want to support them. And again, you can follow us on Instagram, you can Facebook or LinkedIn. ALOISHealthcare.com is our website. If you want to join the clan and become an ALOIS warrior,
I
we would
love
love to
that.
have you. I'd love to support you. So I
I
appreciate
love
again,
the
Anthony, all
clan.
of it. Yeah.
Yeah, Scott, thank you so much for joining us on the podcast. Thank you for listening, everyone. Feel free to reach out if you have any questions, want to be connected. And thanks for listening. Have a great afternoon.